Welcome to MLT Guide and MCQs Part 4. Today I will give you some MCQs in hematology and biochemistry. Number 1. A staining method used to distinguish between myeloid and lymphoid leukemia. Options A. Oxidase, B. Peroxidase, C. Catalase, D. Washburn's method. And the answer is B. Peroxidase. 2. Lupus erythematosus is options A. Type of anemia, B. Type of leukemia, C. Systemic autoimmune disease, D. Type of infection. And the answer is C. Systemic autoimmune disease. 3. Pernicious anemia is due to the deficiency of options A. Iron, B. Vitamin D, C. Vitamin B12, D. Deficiency of cell production. And the answer is C. Vitamin B12. 4. Clot is known as options A. Fibrinogen, B. Prothrombin, C. Thrombin, D. Fibrin polymer. And the answer is D. Fibrin polymer. 5. Hemophilia B is due to the deficiency of options A. Factor 8, B. Factor 10, C. Factor 9, and D. Factor 13. The answer is option C. Factor 9. 6. Von Willebrand's disease is due to the deficiency of options A. Factor 8, B. Factor 9, C. Factor 2, D. Factor 10. The answer is option A. Factor 8. 7. The vitamin that responsible for coagulation. Options vitamin A, B, vitamin K, C, vitamin C, and D, vitamin D. The answer is options B, vitamin K. 8. Oxygen carrying capacity is reduced in options A. Leukemia, B. Hemophilia, C. Anemia, D. Polycythemia. And the answer is C. Anemia. 9. Lupus erythematosus is diagnosed by options A. ANA test, B. DNA test, C. RNA test, D. None of the above. The answer is option A. ANA test. 10. Plasma cells are formed from options A. T lymphocyte, B. B lymphocyte, C. Neutrophil, D. Monocyte. The answer is B. B lymphocyte. 11. Clima needle is used for options A. Lumbar puncture, B. Liver biopsy, C. Bone marrow aspiration, D. Blood collection. Answer is C. Bone marrow aspiration. 12. Test used to differentiate fetal blood from maternal blood. Options A. APT test, B. PT test, C. APTT test, and D. BT test. The answer is option A. APT test. 13. Osmotic fragility test is increased in options A. Iron deficiency, B. Thalassemia, C. Inherited spherocytosis, D. Megaloblastic anemia. The answer is C. Inherited spherocytosis. 15. Test used for collagen disorder. Options A. PCV, B. MCV, C. ESR, D. MCHC. And the answer is C. ESR. 16. Anticoagulant used for ESR. Options A. EDTA, B. 3.2% sodium citrate, C. 3.8% sodium citrate, D. Double oxalate. And the answer is C. 3.8% sodium citrate. 17. Trapkin solution is used for options A. HB estimation, B. ESR, C. RBC count, D. WBC count. And the answer is option A. HB estimation or hemoglobin estimation. 18. Hemoglobin is expressed as options A. Percentage, B. Gram per deciliter, C. Gram per liter, D. Milligram per deciliter. The answer is option B. Gram per deciliter. 19. Precursor cells of platelets. Options A. Thromboblast, B. Megakaryoblast, C. Lymphoblast, D. Erythroblast. And the answer is B. Megakaryoblast. 20. Mother precursor cells of all blood cells. Options A. Stem cells, B. Plasma cells, C. Megakaryoblast, D. Blast cell. The answer is A. Stem cells. Next, biochemistry. 1. Acute myocardial infarction shows increased level of options A. ALP, B. SGPT, C. ACP, D. LDH. And the answer is D. LDH. 2. Tumor marker for colorectal cancer. Options A. CA125, B. CEA, C. CA19.9, D. CA50. And the answer is B. CEA. 3. Ovarian cancer marker. Options A. CA50, B. CA19.9, C. CEA, D. CA125. And the answer is D. CA125. 4. Which enzyme shows an elevation in alcoholic liver disease? Options A. ALP, B. SGPT, C. SGOT, D. Gamma GT. And the answer is D. Gamma GT. 5. Needle-shaped dosazone is formed by options A. Glucose, B. Lactose, C. Sucrose, D. Maltose. And the answer is option A. Glucose. 6. Reserve carbohydrate in plant kingdom. Options A. Starch, B. Glycogen, C. Dextrans, D. Chitin. And the answer is option A. Starch. 7. Reserve carbohydrate in animal kingdom. Options A. Starch, B. Glycogen, C. Cellulose, D. Insulin. And the answer is option B. Glycogen. 8. Which of the following is a heteroglycan? Options A. Dextrans, B. Agar, C. Chitin, D. Insulin. And the answer is B. Agar. 9. Glycerol and soaps are formed due to the saponification of options A. Cholesterol, B. Waxes, C. Triglycerides, D. Unsaturated fatty acids. And the answer is C. Triglycerides. 10. Name one unsaturated fatty acids. Options A. Stearic acid, B. Palmitic acid, C. Arachidonic acid, D. Linoleic acid. The answer is D. Linoleic acid. 11. Which one is known as bad cholesterol? Options A. LDL, B. VLDL, C. HDL, D. Triglycerides. The answer is option A. LDL. 12. Blood urea level is increased in options A. Liver disease, B. Cardiac disease, C. Renal disease, D. Protein ingestion. And the answer is C. Renal disease. 13. In DNA, bond between AT and GC are options A. Covalent bond, B. Hydrogen bond, C. Phosphate bond, D. Quadruple bond. And the answer is B. Hydrogen bond. 14. Handrails of DNA consist of options A. AT, B. GC, C. Sugar and phosphate, D. Purines only. And the answer is C. Sugar and phosphate. 15. Sickle cell is formed by the substitution of glutamic acid by options A. Leucine, B. Isoleucine, C. Valine, D. Methionine. And the answer is C. Valine. 16. Scurvy is due to the deficiency of options A. Vitamin A, B. Vitamin D, C. Vitamin C, D. Vitamin E. And the answer is C. Vitamin C. 17. Beta ion ring system is present in options A. Vitamin A, B. Vitamin B, C. Vitamin C, and D. Vitamin D. And the answer is option A. Vitamin A. 18. Which vitamin plays an important role in vision? Options A. Vitamin C, B. Vitamin B, C. Vitamin A, D. Vitamin B. And the answer is C. Vitamin A. 19. The vitamin which is totally absent in plant sources. Options A. Thiamine, B. B12, C. Riboflavin, D. Vitamin K. And the answer is B. B12. 20. Pellagra is caused by options A. Pantothenic acid, B. Niacin deficiency, C. Cobalamin deficiency, D. Retinol deficiency. And the answer is option B. Niacin deficiency. Thank you. Every Sunday you can expect a new video. For new videos, please subscribe my channel and press bell icon for notifications.